Cancer cannot utilize sugar, so it converts the sugar to lactic acid. So how can we tell how effective the cancer is, or how strong how strong the cancer activity is? We can do that by measuring the lactic acid content. When cancer patients come to me, their pH is 5.5 or 5. At 4.5, the cancer patient will die. So our job is to raise the pH. When cancer cannot use, because cancer cannot use sugar, it converts it to lactic acid. When we take pH paper into our mouth, we're checking the amount of lactic acid your body is producing. And this correlates directly to the amount of cancer activity. The higher your cancer activity, the lower your pH, which means your pH will be around 5, 5.5. So by taking the green juices, you start reducing the lactic acid, and you must prohibit the cancer patient from taking any fruit, because fruit is converted to sugar, sugar is converted to lactic acid, and that's the food for the cancer. So what we do, we allow only 5 fruits: Granny Smith apple, raspberries, blueberries, blackberries, and cherries and strawberries. Those are the only fruits we allow. Those are acidic, with exception of the Granny Smith apple, which is neutral. As we reduce the sugar concentration, the lactic acid begins to go down. When the lactic acid goes down, the pH goes up. So lactic acid goes down, cancer activity is going down. Let me repeat that. When the cancer activity is going down, your pH is going up. So you come in with pH of 5, cancer activity is very, very high. You start taking your green juices, cancer activity is being reduced. That means the lactic acid is being reduced. As the cancer lactic acid food is reduced, the pH begins to go up. Your pH goes up, it indicates your cancer is going down. I've seen doctors say, well, we've given you chemo, now go home, eat a lot of mashed potatoes, steak, butter, and then come back when you get stronger. What they're telling them is go home and eat cancer. White bread, potatoes, gravy, all that makes sugar. Sugar makes lactic acid. So they're in complete, they have no knowledge of the pH system. They have no idea. I've had many oncologists say, well, what the hell does the pH have to do with cancer? There's no sense. You cannot educate people whose mind is made up. They have no idea, have no clue. So what I say, always get a second opinion. Doctor tells you got cancer. It's no big deal. You're not going to die. The only way you're going to die if you get harsh chemical treatments, because it wipes out your immune system. We all know people that had 1 or 2 shots of chemo and they died, or they went up in intensive care for 60 days. The Lord gave us the seeds, the herbs, the oils, the teas, and the herbs to take care of our body. He didn't say, I'll give you the AMA, the FDA, and the pharmaceutical companies to get rid of your cancer. When women come to me with cancer, the first thing I say to them, what has caused you to have cancer? Is it your boyfriend? If it's breast cancer, I always know it's a man. I said, okay, who's the culprit in your life? And they said, no, no. I said, don't play games. I'm not a diplomat. Who gave you cancer? Go back 8 years from today and you can pinpoint the day that it happened. Well, my husband left me for an 18-year-old girl, or I found out my husband cheated with my sister, or things like that. Let it go. It happened many years ago. Let it go. To me, if your husband is unfaithful or he's causing you problems, get rid of him. Men are like taxis. Get rid of him. Don't like the ride, get another ride. So I tell women, you hate this guy? Yeah. All right, here's what to do. You got to get rid of that anger, because that anger makes you acidic, and acid feeds the cancer. Let me repeat that. The cancer, the anger makes you acidic. The acid feeds the cancer, which causes a drop in oxygen called hypoxia. So I tell women, I'll show you how to get rid of the anger. Well, there's no way. It's easy. Listen to me. Go get a picture of the person that's causing this cancer, your husband, boyfriend, boss, whatever. Go down to the mall. Get his picture, put it up have him blow it up on a t-shirt. Then go buy a big pillow and go buy a baseball bat. And then put the t-shirt over the pillow and take it where you want to hurt him the most and get your baseball bat and beat the living crap out of him. People say, well, I think you're crazy. I say, yeah. But once they start doing it, they call me and say, oh, Dr. Bernardo, I feel so good. One woman even told me, by God, I was almost close to an orgasm. I felt so good beating them up like that. You got to let go of the anger. It's water over the dam. All it's going to do is kill you. I've had a woman die because she wouldn't get rid of her anger. I said, it's been 10 years, for God's sakes. What's the matter with you? Well, I can't let go. I said, well, you'll die. And she died in 3 months. So negative emotions, death in the family, a death of a loved one, death of a child, all those are strong negative emotions causing hypoxia. Hypoxia feeds the cancer. That's very simple. I gave a lecture in Reno for 200 doctors. One guy got in front of me and he said, well, after 8 months, I turned around about 15% of my cancer patients, blah, blah, blah. So he talked for an hour. I got up there, gentlemen, I'll make it short and sweet. If I cannot start turning around a stage 4 cancer patient in 30 to 40 days, I should not be practicing. Thank you very much. Man, they jump out of the chairs, got me in a corner. I got in a fighting position. He said, what do you mean? What are you talking about? Are you crazy? I said, go talk to Dr. Steve Levine. He'll tell you. With my own eyes, I have seen Lazarus arise in his hospital. I've seen men that were given 1 or 2 days, and a week later they're having breakfast in the dining room. So the program works. Get rid of all the negative emotions. If it helps you to pray, pray. It helps you to talk with a friend, friend. Get rid of the negative garbage. Get rid of it. You worked, you got a hostile employee or your boss, get over it or change position. All this will make you hypoxic. The more hypoxic, the more acidic. The more acidic, the more the cancer grows. I have every type of patient in the world has come to me. Brain tumor, lung cancer, breast cancer, pancreatic cancer. And what happens? They get on the program. Those that follow the program religiously get well. And I have many testimonial letters that prove what I've been saying. Like I said, I've been doing this for 60 years. Last month, 60 years on the 16th of April. And I've devoted my life to saving lives. Because as a young man, as you know, I went to Korea. With 4,000 other medics, a year later, only 7 of us came out. And I made up my mind that I would never let anybody die in my presence. And I've stuck to that. People say, well, maybe this guy's wealthy. I'm not wealthy because when people come to me, they had no money. I still treat them. I have never turned anybody away. To turn somebody away because they had no money, in my eyes, is criminal. 12 years ago, I had prostate cancer. All my nurses were crying. They had not given me the results of the blood test. They had seen it before, and they were all crying. So I said, why are you girls crying? And they wouldn't answer. I said, damn it, why are you crying? What's the matter? He said, well, you got cancer, you're going to die, and we're going to lose our job, and nobody pays us as much as you do. I said, if I cannot get rid of my cancer in 30 days, I deserve to die. And about 30 days, it was gone. My PSA at that time was around 42 or so. So cancer, it's not a death sentence. On my cards, I put on there, cancer is not a death sentence. It is a major inconvenience. That's all it is. It's a pain in the butt. It makes you aware of certain things. It changes your priority in life. The stuff of going shopping every day and accumulating possessions, possessions are for fools. What matters is that you love somebody and the love is reciprocated to you.